Thank you very much, Amy. Could I ask you to come and join the panel as well, please? Thank you. I think that was a really well-versed and covered area of some of the competencies and abilities of what we can gain from international health. But I'd like to bring a personal slant to this again. And I'm going to turn to Andreas here. Andreas, I know you worked in South Africa for a while, and in your professional experience, how do you think you developed professionally? What skills did you gain that you think might be relevant and valuable for us as individual emergency physicians?
Thank you. So just to introduce myself, my name's Andreas. I'm an emergency medicine consultant in the UK, and I did things a little bit differently to a whole lot of other people have done it. I trained in South Africa and then came across to the UK as a consultant. And I think coming to your question, the experience I've had both at an undergraduate level and during my specialization, this resonates in my day-to-day work. It influences how I make decisions, and I think that's sort of some of the points that Amy's been made. How I coordinate my department, how I deal with certain situations, and I think the other thing I think that probably builds on one of the points that Terry's made this morning is that you don't really need a lot of money to provide excellent care in emergency medicine, and I think it's just looking at the resources that we have, particularly in the NHS in the UK, and appreciating that the amount of resource we have, and not wasting that, and sort of using that in a responsible manner in my day-to-day work.
That's a great question. I wonder if anyone, Amy, do you want to try and respond to that? That'd be great.
So it is a very good question, and actually it ties in a little bit to the question from the young lady before on the last session. I think it's very important that we understand individually why we want to go and work in a different context. And I would say it's about looking at about contextual health, understanding the wider health implications, understanding what impacts on health, and you gain that understanding by working across, and I use the word context a lot, but working across different contexts, so low income, middle income, high income, and within those countries, again, different communities, different community infrastructures. So understanding why you as an individual would like to do that, and then, and there's obviously going to be an altruism aspect, but also there's going to be personal gain that you may have from the interest you have in that community or that culture or that country. In terms of making sure that you do no harm, it's again a very good question. Actually, I'm going to tap into something that I'm sure Terry's very familiar with as well, is the changes going on now at WHO about ensuring that many of the organizations which work overseas, particularly within humanitarian emergencies, and that's just one aspect of global health. I don't want that to be the main aspect, but also those that work in development are meeting the minimum standards and having the teams of professionals, of healthcare workers. We don't just talk about doctors here, we're talking about healthcare workers who form a team. They are meeting the minimum standards required to deliver a safe, governed and effective healthcare overseas. And so to ensure that you are preventing doing any harm is to engage with an organization that is following those what's called emergency medical team standards, and there's a lot available on the WHO website about that. And those standards encompass understanding and being having the cultural awareness, having the right training, having the right awareness of logistics, having the right awareness of politics, aid, etc., etc. And so it prepares someone and a team very well, and it minimizes, it doesn't stop, but it minimizes us perhaps doing harm into a community. And of course, we must be invited into a community as well when we're delivering healthcare, not just assume we're wanted, which is a big problem with emergency humanitarian response. I can't remember the last bit of your question, but I think professionally, there is so much to gain, and it's not about just gaining it. You're obviously delivering a healthcare service as well, part of a healthcare service when you are working, especially with an organization such as Médecins Sans Frontières or the Red Cross or many others similar. But professionally, there is such a lot to bring back to your department to inspire your colleagues to really start to or further develop this passion for medicine that we all started with many, many years ago and perhaps have lost along the way, and to really see the scope of medicine. It isn't just about clinical care. It is more about the community, about how individuals live. It's about resources. It's about infrastructure. It's about access. It's about health equity. All of these things that we really don't get to see much in the NHS, and we're very lucky with our resources. So there is definitely personal gain. There is definitely professional gain, and I think there's departmental. With that professional gain, there's departmental gain as well. I don't know if anyone's got anything to add.
Yeah, so I think from a personal point of view, it makes you a more complete clinician. I think it makes you a more rounded person, both personally and in your day-to-day clinical work, because you're seeing how different systems work. You see how different people do things. You see how different, what the different options are in terms of dealing with a particular situation. That's not just a clinical case. It's around all the bigger things that Ames just talked about, around the day-to-day working in an emergency department. And probably in any health system around the world, is that there are different ways, and particularly when you're stuck in a situation that doesn't fit the guidelines or doesn't fit your departmental policy, how do you deal with that situation on a day-to-day basis? And I think that's what has improved me as a clinician and as a person as a whole.
Yeah, it's a slightly different approach, I think, also to the question. And it's certainly critical to go with reliable organizations and follow locally generated priorities and needs, and to do that responsibly and within your scope of practice. And I think, but there's always something, I think there's something else behind the question too, and there's a quote, really one of those sentences that you come across that kind of really changes your life in a way, changes the way that you think about things. And it's a woman named Lila Watson, who was an Aboriginal activist in the 70s in Australia. And she has this great quote, which sounds a little aggressive on the surface, but really changed the way I thought about things. And it says something like, you can Google this and fix it for me, but it says something like, if you have come to help me, then you can go home. But if you've come because your liberation is tied up with mine, then let us work together. And that was a very powerful shift to me for, help is a very dangerous concept. When you walk in thinking you're helping, all kinds of things are already wrong with your assumptions in the scenario. And no one's doing that because they're bad. It's out of the best feelings. But it is actually very nice to be freed up to think, okay, I'm coming to work with someone. And it built into that inherently then is what are the local priorities that were identified. It also means there's nothing wrong with you wanting to go somewhere else and work in a different country. It's the world that you live in. So a lot of the things that we've talked about that have become much better over the last couple decades, but a lot of the language around it just reinforces this kind of us and them. I'm going to go somewhere else, and how do I do that carefully and respectfully and not screw this up? And really, it should bother you. It should be unacceptable to you that some of these things happen in your world. It's just the one world, and it is yours, and you should be invested in it. And it's even particularly artificial to think of it as being outside Europe, because I can assure you from the system point of view, there's a lot of room within Europe. But that one sentence just helped me reset my mind. Whenever I was confused, I worked in Tanzania for many years, and when I was confused about a choice that I had to make, just thinking about that one sentence actually often clarified immediately for me what the right choice was.
I could probably take about an hour or more to talk about that, so I'll keep it very brief in less than a minute. If you view it like this, if we are going into the emergency department to work as a doctor, nurse, healthcare assistant, we need to be trained to do that. If we're going to work in a pre-hospital environment, so with the pre-hospital care teams, which many of you may have been involved in, we go through a training. But for many years, there was no such training, or perhaps not even deemed needed, to go and work in one of the most complex, challenging environments that you can go to, particularly in humanitarian emergencies, which is what the focus of the EMT initiative at WHO is about, predominantly humanitarian emergencies. And so in the recent years, there's been a big drive to say we need to develop people's understanding, knowledge, skill set. Competency is a hard word because I don't know how you measure a competency in working within that environment. We don't have the same necessary systems that we do for when we measure our own competencies in the NHS. But we need to get have people have an understanding, and the chaos from Haiti, the chaos from other humanitarian emergencies can be clearly seen regarding the medical errors that happened and management errors and coordination errors because teams were not trained. So now there's a big drive, and there are minimum standards for training for all personnel, healthcare workers that are going to look to engage in deployment during or after a humanitarian emergency and work similar. And that covers, very briefly because I know time's up, it covers, clinical is a small aspect. It is almost, I don't know whether the smallest aspect of working in many of the contexts, because we have many of the clinical skills, although we actually further develop a lot of them, especially the clinical acumen. But it's about understanding that context, situational awareness, understanding logistics, understanding access, understanding cultural infrastructure, community infrastructure and their cultural behaviours, understanding human behaviour, understanding human factors, all of those elements. And that's what we're driving forward at the moment with the EMT work and creating a pool of professionals who have the knowledge and understanding needed, at least the initial part, to step forward into that global health arena.
With that, I'd like to thank the panel. It's clearly a very activated, motivated conversation. We can continue online on social media if need be, or obviously meet us in the forums. I think you've covered a lot of issues around creating this global health movement per se, where it's not just about personal motivations, it's about skills, it's about systems, and thank you for sharing some of your insights with that. A round of applause for the panel, please. Thank you.